Fundamentals of Nursing Advanced Test. Question 1. Which hormone is secreted by the islets of Langerhans? Progesterone, testosterone, insulin, hemoglobin. Insulin is the hormone secreted by the islets of Langerhans in the pancreas. Question 2. What is the transparent membrane that focuses the light entering the eyes onto the retina? Lens, sclera, cornea, pupils. The lens is the correct answer because it is the transparent biconvex structure in the eye responsible for focusing light onto the retina. Question 3. Which of the following is included in Orum's theory? Maintenance of a sufficient intake of air, self-perception, love and belonging, physiological needs. Orum's theory, also known as the self-care deficit nursing theory, emphasizes individuals' ability to perform self-care to maintain health and well-being. Question 4. Which of the following clusters of data belong to Maslow's hierarchy of needs? Love and belonging, physiological needs, self-actualization, all of the above. Maslow's hierarchy of needs is a theory in psychology that categorizes human needs into 5 levels. Question 5. Which type of illness is characterized by severe symptoms of relatively short duration? Chronic illness, acute illness, pain, syndrome. Acute illnesses are characterized by the sudden onset of severe symptoms that typically last for a short duration. Question 6. What is a nurse's role in health promotion? Conducting health risk appraisals, educating clients to be effective health consumers, implementing worksite wellness programs. None of the above. A nurse plays a crucial role in health promotion by educating clients to be effective health consumers. Question 7. How many liters are equal to 1,800 milliliter? 18,180. 2,800. To determine how many liters are equal to 1800 milliliters mil, it's essential to understand the relationship between liters L and milliliters. Question 8. Which of the following is the correct abbreviation for drops? GDT, GTT, SDPDR. The correct abbreviation for drops in medical and pharmaceutical contexts is GDT. Question 9. What is the abbreviation for microdrop? GDT, GDT, MDR, MGTS. The correct abbreviation for microdrop is GDT, choice A. Question 10. What is the meaning of PRN? When advice, immediately, when necessary, now. PRN is a Latin abbreviation derived from pro re nata, which translates to as the situation demands or when necessary. Question 11. Which of the following is the correct meaning of CBR? Cardiac boardroom, complete bathroom, complete bed rest, complete boardroom. The correct answer is C, complete bed rest, because this is a well-established medical abbreviation used in clinical settings to indicate that a patient must remain in bed at all times, avoiding any physical activity to promote recovery or prevent worsening of a medical condition. Question 12. How many drops are equivalent to 1 teaspoon? 15, 60, 10, 30. To determine how many drops are equivalent to 1 teaspoon, it's essential to understand the standard conversions used in both culinary and medical contexts. Question 13. How many milliliters are equal to 20 cubic centimeters to 22,000, 20,000? The correct choice is B, 20, because cubic centimeters cc and milliliters ml are equivalent units of volume measurement in the metric system. Question 14. How many ounces are in 1 cup? 880. 808,000. In the United States customary system of measurement, 1 cup is a standardized unit of volume equal to 8 fluid ounces. Question 15. The healthcare professional must verify the client's identity before administration of medication. Which of the following is the safest way to identify the client? Ask the client for their name. Check the client's identification band. State the client's name aloud and ask the client to repeat it. Check the room number. Verifying the client's identity before administering medication is crucial to ensure patient safety. Question 16. The healthcare professional prepares to administer buccal medication. The medicine should be placed on the client's skin, between the client's cheeks and gums, under the client's tongue, on the client's conjunctiva. Buccal medication is administered by placing it between the client's cheeks and gums. Question 17. For administering a cleansing enema, what is the common position typically used? Sims left lateral, dorsal recumbent, supine, prone. The correct position for administering a cleansing enema is the Sims left lateral position. Question 18. A client complains of difficulty swallowing when the nurse tries to administer capsule medication. Which of the following measures should the nurse take? Dissolve the capsule in a glass of water. Break the capsule and give the contents with apple sauce. Check the availability of a liquid preparation. Crush the capsule and place it under the tongue. When addressing a client's difficulty swallowing capsules, the nurse must consider medication safety, absorption, and client comfort. Question 19. What is the appropriate route of administration for insulin? Intramuscular, intradermal, subcutaneous, intravenous. Insulin is a peptide hormone that requires precise and controlled delivery to maintain blood glucose levels effectively. Question 20. The healthcare provider orders the administration of an ampicillin capsule TID-PO. The healthcare provider should give the medication 3 times a day orally, 3 times a day after meals, 2 times a day by mouth, 2 times a day before meals. The correct answer is A, 3 times a day orally, because the prescription TID-P. Question 21. What is the best description of back care? Caring for the back by means of massage, washing the back, applying a cold compress to the back, applying a hot compress to the back. Back care involves caring for the back through activities such as massage exercises, proper posture, and ergonomic practices to maintain spinal health and prevent injuries. Question 22. What term is used to describe the preparation of the bed with a new set of linens? Bed bath, bed making, bed shampoo, bed lining. Rationale: correct answer B, bed making. Bed making refers to the process of preparing a bed with fresh linens, ensuring it is clean, comfortable, and properly arranged for the patient or individual. Question 23. What is the primary purpose of hand washing? To promote hand circulation. To prevent the transfer of microorganisms. To avoid touching the client with a dirty hand. To provide comfort. Hand washing serves a critical role in infection control and public health, with its primary purpose being to prevent the transfer of microorganisms. Question 24. What should be done in order to prevent contamination of the environment when making a bed? Avoid flinging soiled linens. Strip all linens at the same time. Finish both sides at the same time. Embrace soiled linen. The correct practice to prevent contamination of the environment when making a bed is to avoid flinging soiled linens. Question 25. What is the most important purpose of performing a bed bath? To cleanse, refresh and give comfort to the client who must remain in bed. To expose the necessary parts of the body. To develop skills in bed bath. To check the body temperature of the client in bed. Performing a bed bath serves multiple purposes, but its primary and most important objective is to cleanse, refresh and provide comfort to a client who is confined to bed.